Question 1. A nurse must delegate tasks during a busy shift. Which task is safest to assign to a UAP? A. Assisting with toileting for a stable patient. B. Teaching a patient to use a walker. C. Evaluating a patient's response to pain medication. D. Monitoring for signs of infection. Answer. A. Assisting with toileting for a stable patient. Question 2. A client receiving for morphine is difficult to arouse. What is the nurse's priority action? A. Document findings in the medical record. B. Notify the healthcare provider. C. Assess respiratory rate and oxygen saturation. D. Increase the 4 fluids to flush medication. Answer. C. Assess respiratory rate and oxygen saturation. Question 3. What is the first step in prioritizing client care for a nurse starting a shift? A. Review medication administration times. B. Conduct a focused head-to-toe assessment. C. Receive shift handoff report. D. Check the electronic health record for orders. Answer. C. Receive shift handoff report. Question 4. A nurse finds a patient on the floor. What is the most appropriate initial action? A. Notify the healthcare provider. B. Complete an incident report. C. Assist the patient back to bed. D. Assess for injury before moving. Answer. D. Assess for injury before moving. Question 5. Which task should the nurse avoid delegating to a UAP? A. Repositioning a stable client. B. Ambulating a post-op client with stable vitals. C. Collecting a urine specimen. D. Assessing for pressure injury risk. Answer. D. Assessing for pressure injury risk. Question 6. Which client should the nurse assess first? A. A client who reports mild ankle swelling. B. A client with oxygen saturation of 89%. C. A client requesting a PRN laxative. D. A client with a potassium level of 4.1 milliequivalent/L. Answer. B. A client with oxygen saturation of 89%. Question 7. The RN is planning care for 4 clients, which can be delegated to the LPN. A. Initial teaching for a new diabetic. B. Monitoring drainage from a stable surgical wound. C. Administering for push morphine. D. Developing a discharge care plan. Answer. B. Monitoring drainage from a stable surgical wound. Question 8. What is the nurse's best action when noticing a confused patient wandering into another room? A. Restrain the patient for safety. B. Call the physician. C. Gently redirect the patient to their own room. D. Ask another nurse to intervene. Answer. C. Gently redirect the patient to their own room. Question 9. Which scenario indicates the greatest risk to patient safety? A. A client with a call bell out of reach. B. A client asking for assistance with dressing. C. A client with a side rail down. D. A client whose 4-line has disconnected. Answer. D. A client whose 4-line has disconnected. Question 10. The nurse assigns a UAP to assist a client who is at high risk for falls. What must the nurse do first? A. Tell the UAP to notify the nurse if the client attempts to get up. B. Assess the client's current fall risk status. C. Ask the family to remain with the client. D. Raise all 4 side rails. Answer. B. Assess the client's current fall risk status. Question 11. A nurse finds a patient with a new onset of slurred speech. What is the priority action? A. Notify the provider immediately. B. Assess grip strength. C. Reassure the patient. D. Take a complete set of vital signs. Answer. A. Notify the provider immediately. Question 12. Which of these is appropriate to delegate to a UAP for a client on contact precautions? A. Instructing on the use of PP. B. Monitoring for skin breakdown. C. Feeding the client. D. Assessing bowel patterns. Answer: C. Feeding the client. Question 13. A nurse needs to prioritize care. Which client should be assessed first? A. A client with blood pressure 130/82 mmHg. B. A client with heart rate 60 bpm. C. A client with RR 8 breaths/min on morphine. D. A client with temperature 99.1 degrees Fahrenheit. Answer: C. A client with RR 8 breaths/min on morphine. Question 14. A post-op client is refusing to use the incentive spirometer. What should the nurse do first? A. Notify the physician. B. Reinforce the importance of use. C. Document the refusal. D. Ask the UAP to encourage use. Answer: B. Reinforce the importance of use. Question 15. A nurse asks a UAP to take vitals on a newly admitted client. What is the best action? A. Reassign the task to the LPN. B. Perform the initial vital signs herself. C. Allow the UAP to proceed. D. Document the task as completed. Answer: B. Perform the initial vital signs herself. Question 16. A nurse enters a room where a client is actively seizing. What should the nurse do first? A. Call the provider. B. Place padding under the client's head. C. Attempt to insert an oral airway. D. Restrain the client's limbs. Answer: B. Place padding under the client's head. Question 17. A nurse is reviewing shift assignments. Which client should not be assigned to an LPN? A. A client with a healing stage 2 ulcer. B. A client receiving continuous TPN. C. A client with stable hypertension. D. A client receiving scheduled oral meds. Answer: B. A client receiving continuous TPN. Question 18. What is the nurse's priority action when a client suddenly becomes unresponsive? A. Begin CPR. B. Check carotid pulse. C. Call the family. D. Document findings. Answer: B. Check carotid pulse. Question 19. Which of the following requires immediate follow-up? A. UAP raises 2 side rails. B. UAP uses lift device for obese patient. C. UAP leaves bed in high position after linen change. D. UAP offers oral care after meals. Answer: C. UAP leaves bed in high position after linen change. Question 20. A nurse is teaching delegation to a student nurse. Which principle is correct? A. The RN can delegate nursing judgment. B. The RN retains accountability for delegated tasks. C. LPNs may delegate to UAPs. D. Delegation is based only on convenience. Answer: B. The RN retains accountability for delegated tasks. Question 21. A nurse hears a loud thud in a patient's room. What is the nurse's priority action? A. Notify the provider. B. Call the charge nurse. C. Enter the room to assess the patient. D. Document the incident. Answer: C. Enter the room to assess the patient. Question 22. Which client should be seen first during shift rounds? A. A client who reports burning with urination. B. A client requesting to speak with a chaplain. C. A client with a new onset of dizziness and lightheadedness. D. A client asking for assistance to ambulate. Answer: C. A client with a new onset of dizziness and lightheadedness. Question 23. The UAP reports a post-op patient's dressing is saturated with blood. What is the nurse's next step? A. Change the dressing immediately. B. Ask the UAP to apply pressure. C. Assess the surgical site personally. D. Notify the provider without assessing. Answer. C. Assess the surgical site personally. Question 24. What task can be safely delegated to a UAP? A. Assisting a client with ambulation using a walker. B. Teaching a patient about deep breathing exercises. C. Monitoring a client after 4 medication administration. D. Evaluating a wound for signs of infection. Answer. A. Assisting a client with ambulation using a walker. Question 25. A nurse receives 4 reports. Which client is the highest priority? A. A client with mild dyspnea who is talking normally. B. A client reporting leg pain after walking. C. A client with a blood pressure of 92/40 and confusion. D. A client with a temperature of 101 degrees Fahrenheit. Answer. C. A client with a blood pressure of 92/40 and confusion. Question 26. A nurse notices a new UAP ambulating a post-op client without shoes. What is the best response? A. Praise the UAP for helping the patient early. B. Instruct the UAP to put shoes or non-skid socks on the patient. C. Report the UAP to the charge nurse. D. Continue observation and reassess later. Answer. B. Instruct the UAP to put shoes or non-skid socks on the patient. Question 27. A patient develops an irregular pulse and complains of chest tightness. What is the nurse's first action? A. Notify the provider. B. Check vital signs and initiate telemetry. C. Apply oxygen and call rapid response. D. Administer prescribed pain medication. Answer. C. Apply oxygen and call rapid response. Question 28. Which patient should not be delegated to a float LPN from a med-surg unit? A. A client with cellulitis requiring oral antibiotics. B. A stable post-op client needing routine dressing changes. C. A client requiring hourly neurological checks after head trauma. D. A client with a long-term colostomy needing assistance. Answer. C. A client requiring hourly neurological checks after head trauma. Question 29. A nurse asks a UAP to report any abnormal vital signs. What is the best follow-up? A. Ask the UAP for hourly updates. B. Review the UAP's documentation at shift end. C. Clarify what is considered abnormal. D. Assume the UAP knows based on experience. Answer. C. Clarify what is considered abnormal. Question 30. Which statement by a nurse demonstrates appropriate delegation? A. LPN, please assess the new patient's heart sounds. B. UAP, teach the patient how to self-administer insulin. C. UAP, report to me if a client feels dizzy during ambulation. D. LPN, contact the provider for a new order. Answer. C. UAP, report to me if the client feels dizzy during ambulation. Question 31. A confused client repeatedly tries to get out of bed unassisted. What is the safest action? A. Apply all side rails. B. Use a bed alarm and move client closer to the nurse's station. C. Restrain the patient's wrists. D. Administer a sedative. Answer. B. Use a bed alarm and move client closer to the nurse's station. Question 32. What should the nurse do before transferring a patient from bed to wheelchair? A. Lower the bed to the lowest position. B. Position the wheelchair at the foot of the bed. C. Lock the wheelchair and bed wheels. D. Ask the UAP to perform the transfer. Answer. C. Lock the wheelchair and bed wheels. Question 33. Which scenario demonstrates unsafe delegation? A. LPN changing a sterile surgical dressing. B. UAP checking a patient's blood glucose. C. UAP giving a client discharge instructions. D. LPN administering an enema. Answer: C. UAP giving a client discharge instructions. Question 34. What is the nurse's priority when responding to a fire in a client's room? A. Activate the fire alarm. B. Close all doors. C. Rescue the client. D. Extinguish the fire. Answer: C. Rescue the client. Question 35. A client says, "I feel like I might faint." What is the best immediate response by the nurse? A. Ask the client to lie down. B. Leave the room to notify the provider. C. Encourage the client to take deep breaths. D. Assist the client to the chair. Answer: A. Ask the client to lie down. Question 36. A nurse sees a UAP helping a patient out of bed without a gait belt. What is the appropriate action? A. Immediately stop and assist the transfer. B. Document the unsafe practice. C. Call the charge nurse. D. Ignore unless the patient falls. Answer: A. Immediately stop and assist the transfer. Question 37. Which task should not be delegated to an LPN? A. Monitoring for medication side effects. B. Evaluating effectiveness of pain control. C. Reinforcing teaching about diet restrictions. D. Changing a sterile dressing. Answer: B. Evaluating effectiveness of pain control. Question 38. Which patient assignment is safest for a UAP? A. A client 1 day post-op from knee surgery. B. A client receiving chemotherapy. C. A client with dementia needing assistance with feeding. D. A client with a newly inserted central line. Answer: C. A client with dementia needing assistance with feeding. Question 39. The nurse observes a client with a fall risk sign attempting to get out of bed alone. What is the first action? A. Yell at the client to stop. B. Immediately assist the client back to bed. C. Document the event. D. Ask the UAP to intervene. Answer: B. Immediately assist the client back to bed. Question 40. A nurse finds a client who is confused and wandering into another patient's room. What is the most appropriate action? A. Restrain the client with soft wrist ties. B. Redirect the client back to their room. C. Call the family for assistance. D. Ignore the behavior if no harm is done. Answer: B. Redirect the client back to their room. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.